Have you recently had a knee replacement and are wondering what's the best way to look after my new joint during that post-operative recovery period? If so, you're in the right place, because in this video we are going to look at how appropriate seating can really support you in your recovery journey. My name is Jude Brewer. I'm an occupational therapist and I've got experience working across a number of clinical settings, including the community, inpatient rehab, acute settings and care homes. So knee replacement surgery can take the form of a partial replacement or a total knee replacement. Partial knee replacements are where just a part of that knee joint is replaced due to damage, for example, osteoarthritis, and the total knee replacement is where the full joint is replaced. So the lower part of the thigh bone and the upper part of the shin bone. It can take several months to fully recover from knee replacement surgery, and during that time you might spend a fair bit of time seated. So that's why looking at appropriate seating is really important for that post-operative recovery period. So the first 48 hours after your surgery are really critical in terms of recovery. The lower leg should be really well supported, which is why seating that has an elevated leg rest is very appropriate for this time. Some general advice when sitting would be to not sit for more than 45 to 60 minutes at a time, if possible, so to move regularly, and that's to minimise stiffness, to improve circulation, reduce the risk of blood clots, and including things like moving your ankles and your feet regularly, giving them a little rotation in sitting. So it's helpful to have a chair with a straight back and with supportive armrests. Try not to cross your legs for the first sort of 6 to 8 weeks. So to sit safely after a knee replacement, just slowly and carefully step backwards until you can feel the chair behind your legs. Reach back for the armrests of the chair and then slowly sit down. And to stand, shuffle your bottom to the front of the chair, move your feet slightly forwards and then push up from the armrest of the chair. And of course, if you're using a mobility aid, make sure you have that in front of you so that you've got it for support when you stand. So if you're needing some help with that sit to stand movement in the early days after your knee replacement surgery, you can use the electric rise function on the chair to do that. If you struggle to operate the controls as well as stand up, then you can ask someone to help you with that. So you just sit comfortably in the chair, lift the chair up as far as you need it to go. And then with both hands on the armrests of the chair, push up to stand. Before sitting down or standing up, always ensure the brakes are firmly engaged to prevent the chair from moving and to provide a stable base for a safe transfer. The electric riser function on the Lento mobile chair is really useful, especially in the early days, just relieving a little bit of strain in that knee and the thigh during that sit to stand movement. Some key features to look for in your chair would be the elevating leg rest to enable that support of the leg, the riser recline function to assist with that sit to stand movement if required in the early days post-surgery, the adjustable seat depth, adjustable arms, a nice supportive adjustable backrest, and firm supportive padding. The Lento mobile chair has all of these functions, so it makes it really ideal for you if you are recovering at home. The high back bedside chair is ideal for that post-operative period in hospital. It has the adjustable seat height, it has the antibacterial wipeable fabric, and it also keeps the knee at a really well supported position. So the right chair will support recovery right from the first really critical 48 hours after surgery and into the months that follow. Vivid Care offer a free, no obligation seating assessment wherever you are, which can be carried out in collaboration with your occupational therapist. There are options for either purchase or hire. So if you only need the chair for a very short period, for example, during that post-operative recovery period, that is an option.